Dr. Samadi, you're very renowned for talking about the importance for prostate cancer patients and educating themselves on their care, and more specifically about the importance of the person, the surgeon, behind the technology. Talk to us about what you mean in regards to that.
Well, as you saw, this is not the robot where you actually press the button and you come back. It doesn't do anything on its own. It's the experience of the surgeon, and that's extremely important when you're deciding, you know, which institution, which surgeon to choose. Having the team, as you saw, there's a lot of interaction with the anesthesiologist, with the team. So I'm really privileged to have the same team all the time. We've done well over 3,000 of these cases, and without any complications. And it's a remote control surgery, so the surgeon has to interact with the team, and it's important to have that kind of people in the room that know really what they're doing. Creating a center of excellence where this is all I do 8 to 10 times a week has allowed us to be able to get the kind of results we want for our patients.
Let's look at this other clip here.
Yes, there seems to be...
because this really shows this nicely, too, and it's what I experienced.
The healthcare system in this country has no problem. I think it's the individual responsibility of the patients that has allowed us to kind of become this lazy nation of gaining weight and diabetes that has put burden in the system. The healthcare system in America has always been the leading system in the world. I think from the technology to science to research, especially outcome research, we've been the frontier. A lot of urologists from all over the world come here to Mount Sinai to see our surgery and learn from this. In our hands, in the past 2,000 patients, the blood loss is minimum. Less than 0.5% of patients have gotten transfusion. Over 90% of the patients are being discharged within a day after surgery. 97% of the patients are continent and they can control their urination. 85% of the patients are able to have sexual activity after this surgery in our hands. All in all, from cancer cure rate, urinary control, sexual function, this by far, in our hands, with the experience that we have, has been a major advancement in the field of medicine over the past few years. Technology is a superb addition to our work. A great technology can help the surgeons, but you have to know how to use the technology.
Dr. Samadi, what is the follow-up care for patients having undergone this process?
Well, the advantage of this is that once the prostate is removed, 6 weeks after, when I see the patients, their PSA has to be 0. And that's the beauty of surgery as opposed to other modalities. Unlike radiation and other cryotherapies and other modalities, PSA after surgery has to be 0. So I can always look at my good friend over here, Dr. Lazzaro, and say, you're cured from prostate cancer. Every 3 months when we check the PSA, that has to be 0. Now, let's just say, for argument's sake, he will go on for 10 years and the PSA will start to come back. I hope that never happens. But if it does, number one, I will know that there's something wrong. And number two, I always have the option of giving him low-dose radiation after surgery. So you remove the cancer, easy follow-up, knowing where you stand with your life, and at the same time having the option of radiation is absolute winner for my patients.
We're going to continue the conversation more with Dr. Lazzaro and Dr. Samadi right after this.
Board-certified plastic surgeons use the interlocking circles logo of the American Society of Plastic Surgeons. Looking for the expert in aesthetics? Look for the second logo of the American Society for Aesthetic Plastic Surgery.
And welcome back to Aesthetic Medicine. Dr. Samadi, where can our viewers go to get more information about you and this robotic technology?
There's a website called roboticoncology.com, and this is there's a lot of information on this site. It's also translated in 7 different languages, so whatever we spoke tonight, it's all on that website.
And Dr. Lazzaro, in February, your life is basically changed with a phone call. You do your due diligence in your research. You find and locate Dr. Samadi and opt for the robotic surgery to remove the prostate. Walk us through your post-operative experience from that point.
Well, I had the operation on March 31st on a Thursday. I was discharged from the hospital, Mount Sinai, on Friday, and I was out watching a Broadway play on Saturday. We stayed for a week because you have to go back then to remove your catheter. I went out to dinner. My wife and I enjoyed the city. We went to 3 different shows that week and went to dinner every night. And after I came back to see Dr. Samadi, I told him, I said, this is probably the best vacation I had in New York, and I wish I had another prostate.
That's a little bit of extra effort to go to New York City.
Yeah.
And let's talk about also, if there's one message that you want every man to grab onto by listening to your journey and your story, what would that be?
It's that we're all going to die from something. Let's not die from something we can prevent. This is simple screening. Every man should be doing this and start early. And then select the surgeon or the modality you're going to do, but do it early, and you're going to beat this disease. Let's die from something else, not what we can control.
And prevention and early detection is always
stronger
the key.
than cure.
Always the key. Well, for more information on tonight's topic, or to contact Dr. Samadi, you may contact roboticoncology.com. That's roboticoncology.com. Dr. Samadi, thank you so much for joining us and for taking the time to come to our beautiful city. We would love to have you come back sometime again as well.
It was a pleasure taking care of my good friend, Dr. Lazzaro.
And thank you for keeping him in good care.
It was a pleasure having him take care of me.
And thank you so much for joining us, and we'll see you again right here on Aesthetic Medicine.
Good night.
Aesthetic Medicine has been sponsored in part by the Estique Medical Center.